Hi, my name is Elizabeth Wright. It is 12/28/2022. I'm going to be talking about case study 4. So I picked case number 2. A full-term girl was born by normal vaginal delivery and was released from the hospital at day 3 of age. So at 9 days of age, a screening test for branched chain amino acids came back positive. So most likely enzyme deficiency in which amino acid is no longer metabolized. So this is maple syrup urine disease. It's an enzyme deficiency caused by a mutation in the branched chain A keto acid dehydrogenase complex. The 3-branched amino acid chain is unable to be metabolized, so leucine, isoleucine, and valine, the triple-branched amino acids, are unable to be metabolized. So if any amino acids become essential as a result of the deficiency. So the baby's body is unable to break down amino acids called leucine, isoleucine, and valine, so therefore these are in high levels in the of amino acids in the body. So potential vitamin supplements that may be useful for the condition, what steps in the metabolism could they potentially help with? So if the baby has thiamine responsive MSUD, they can be given thiamine B1, and thiamine acts as a cofactor for BCAA catabolism. Thiamine may be helpful in addition to also eliminating BCAA from the diet and not taking in those amino acids. It's really rare that a patient would just be able to start thiamine. I think there was one reported case that I had read about where the patient didn't have to make any dietary restrictions and could just take in thiamine. So scenario 2, the 69-year-old woman presented with a 30-year history of lower back pain and large joint pain. She had blue-gray pigmented macules all over her body. Most likely enzyme deficiency in which amino acid is no longer metabolized. So this is alkapatonuria. Defect in the enzymes involved in the metabolic pathways are phenylalanine and tyrosine. The cells normally in the liver form tyrosine, and tyrosine reacts with aminotransferase to form dihydroxyphenylpyruvate, eventually forms acetoacetate and fumarate. Acetoacetate is used to form ketones, and fumarate is used to form glucose molecules. So the defect lies within the homogenate enzyme, and acetoacetate and fumarate cannot be formed. If any amino acids become essential as a result of the deficiency, no, the amino acids tyrosine and fumarate are unable to be formed, and this leads to a buildup in homogenistic acid. And homogenistic acid is eventually oxidized to a benzoquinone acetic acid. So potential vitamin supplements that may be useful for the condition. Vitamin C may be helpful because it can help reduce the homogenistic acid to benzoquinone acetic acid. And then scenario 3, a 4-day-old infant is being followed in her clinic. In your clinic, her birth weight was 5.9 pounds. So she had phenylalanine level of 6.6. So most likely the enzyme deficiency in which amino acid is no longer metabolized. So there is a problem in the metabolism of phenylalanine, high levels of phenylpyruvate in urine. Phenylalanine is transformed into phenylpyruvate. Phenylalanine hydroxylase uses the cofactor tetrahydro. It is built inside of our cells. If there is a problem with the enzyme, phenylalanine hydroxylase is the reaction and will not be able to take place. Tyrosine is normally formed in this reaction and then goes on to the liver to form acetoacetate and fumarate. What amino acids become essential? So high levels of phenylalanine. This can cause neurological issues and death in as early as 20 or 30. Protein, so potential vitamin supplements. So really protein intake needs to be limited. So often patients are going to need to be on a vitamin B12 and B6 supplement as they are not getting those animal products in their diet. And then so moving on to case 4, a 58-year-old woman presents to the emergency department with progressive fatigue and weakness for the past 6 months. She is short of breath walking 6 blocks. So I'm not going to read the whole thing, but that is the case that I'm focusing on. So which of the following vitamin deficiencies is the most probable cause of this presentation? Discuss each option and note which deficiency is the most likely. So your straightforward iron deficiency, lack of iron causes the reduced amount of red blood cells in the body. These red blood cells transport oxygen around your body to different tissues. Long-term iron deficiency may cause problems to the heart and lungs. Symptoms of iron deficiency include weakness, pale skin, brittle nails, chest pain, fast heartbeat, poor appetite, unusual cravings, and fatigue. So it's more common in reproductive age women and children. So there's different types of how we can get to iron deficiency anemia. So decreased intake, low dietary consumption, typically children on cow's milk, vegan and vegetarian diets, malabsorptive conditions, which are celiac disease, Crohn's disease, and any history of GI surgeries, bariatric surgeries. Increased losses, so hemolysis, it could be like a DIC presentation, hemorrhage, menstruation, menorrhagia, GI bleeding, acute nosebleeds, and bleeding through the urinary tract, and then increased utilization where your body is needing to use more of it. So pregnancy is would be one of those options. And the labs for it would show low serum iron, low ferritin, and increased transferrin. So in a B6 deficiency, people can become deficient in B6 from stress, alcohol, taking the wrong form of the supplement. B6 is water soluble, and that is important in different enzymatic reactions in the body, such as synthesizing amino acids, fatty acid metabolism, and hemoglobin synthesis. Symptoms can include microlytic anemia, dermatitis, cheilosis, cracks around the mouth, a swollen tongue, depression, confusion, weakened immune system, fatigue, and low energy. So it's interesting, an excess of vitamin B6 could actually show what the patient is presenting as in the picture. So numbness and tingling, increased photosensitivity. I thought that was an interesting piece, so I wanted to put that in there. And then vitamin B12, which is what this picture is really presenting. It is important for the synthesis of DNA, fatty acids, myelin. People can either be deficient from an autoimmune disease, malabsorption, or dietary insufficiency. So history gathering, as it's important in all of these cases, it can be really important in this. Asking about GI issues, bowel surgeries, resections, and diet. Symptoms, changes in gait, which we've seen in the picture, a sore red tongue, pins and needles, fatigue, tachycardia, and neurological dysfunction. So discuss how this vitamin deficiency impairs purine or pyrimidine metabolism. So purine and pyridine are both essential when it comes to forming DNA. Pyridine is known as a base and contains thymine and cytosine. Purines in DNA are guanine and adenine. So B12 deficiency can lead to low amounts of thymidylate, which causes uracil to replace thiamine in the base. So this can lead to programmed cellular death and issues with DNA maturation. So potential laboratory tests and findings that would assist in the differential. So for vitamin B12 deficiency for lab tests, you would probably see a mean corpuscle volume value, which would be greater than 100 and would indicate macrocytosis, an MMA level, which is methylmalonic acid test, B12 blood test, and a CBC. Thank you.